Hello, so today I'll be doing oral and topical medication administration. So I've already pulled my meds before I came into the room, and I checked them 3 times, once looking at the provider's orders to make sure everything was correct when I was pulling the meds in the med room, and then at the bedside before I give the medication. And each time I'm looking for the right patient, right drug, right dose, right route, right time, and right documentation. So I also am going to review my patient's allergies and make sure they're not allergic to anything I'm about to give them. So I'm going to knock, enter my patient's room. I'm going to identify myself and greet them. I'm going to ask them for their name and date of birth, and I'm going to check their armband to make sure everything matches and I have the right patient. I'm going to explain what I'll be doing today, provide for privacy, wash my hands, and put on my gloves. So for an oral medication, they're getting enalapril, 10 milligrams PO once daily, and it's for hypertension. So I'm going to take their blood pressure and assess that before giving their medication to make sure that it's safe for them to give it. And if the medication is extended release or enteric coated, then I'm not going to alter it in any way, which means I'm not going to cut it or crush it and put it into food or anything like that. I'm just going to make sure they take it exactly how it is. And so I'm going to give my patient their oral medication. And then I'm going to give them a minute to swallow that. I'm going to make sure they have enough water or something to drink to take the medication with. And then once they've taken it, I'm going to ask if I can check the inside of their mouth. And so I'm just going to take my pen light and look for pocketing, and I'm going to check under your tongue. Okay, and then I'm just going to feel their jaw to make sure that they've swallowed it and they haven't pocketed it anywhere. And then I'm going to document that they took their medication. I'm going to document my patient's name, the medication that I gave them, the dose of it, and what route I gave it. And then for their topical medication, they're getting 1% hydrocortisone cream to their rash. So first I'm going to wash the area with just soap and water to make sure that it's nice and clean and make sure it's nice and dry before I put anything on them. I'm going to change my gloves. I'm going to wash my hands again and put new gloves on. And then I'm going to take my medication, however much is ordered or needed to cover the affected area. And so my area is washed, and I'm just going to apply the medication. And then I'm going to have them stay in the anatomical position necessary for the medication to dry. And I'm going to make sure that it is dry before they move. I'm going to educate them to try not to cover their leg back up or rub it in any way. And if necessary, I can cover it with a dressing just to be sure that they don't move their leg before that medication is absorbed. And then I'm going to come back in about 30 minutes and make sure that they have the therapeutic effect for each medication, their blood pressure. I'm going to reassess their blood pressure for the oral medication, and then just make sure that they don't have any complaints. And before I leave my patient's room, I'm going to make sure they have their call light, and I'm going to take my gloves off, wash my hands, and I'm also going to document the topical medication, the medication I gave them, the patient, the dose that I gave, and what time I gave it.